CNIS is Canadian Network for International Surgery, and really is a group of doctors, surgeons, obstetricians, and anesthesiologists who really find the value of surgery in global health. And what they do is partner with the local teams in mostly sub-Saharan African countries and work together to supply that need.
Doctors from CNIS, partnering with Cuso International and Cuso Tanzania, were in the Kigoma region recently to hold a number of workshops with local medical personnel. The purpose? To improve surgical techniques pertaining to maternal health.
We do teach theory, but a lot of our work is hands-on with the participants. They come into a session with us, and we observe them and we go through with them every step of the surgical path till they become competent in that scenario.
We're not here because we think we're better than them. We're here because we care about the same thing that they care about. We care about decreasing global maternal mortality, and that's the only reason we're here.
Usually it's a 3 or 4 day lab part followed by a practical part. The lab part is usually morning of interactive discussion. The afternoon is all lab, and this is where we have, for example, a female pelvis with a layered abdominal wall, and they actually take a blade, a surgical blade, and cut through the abdominal wall. They go through different layers.
You have to get the assistant to help you. Maybe a retractor?
During that time, we can observe everything from decision making to technical skills, how they hold the blades and things like that.
They've seen women die because of things that they haven't been able to control. They may have seen people bleed to death because they didn't quite know how to handle it. Or they may have been in a situation in the operating room where they didn't quite have the skills to deal with the complication they were seeing.
The group of 11 assistant medical officers work in various areas of the Kigoma region. For some, they had to travel for days to be able to attend this training.
Mimi nilivyoanza safari yangu nilipanda boti kutoka pale Kalia mpaka Ikola, ni muda wa masaa 9 mpaka 10 ambayo tuliyatumia. Baada ya kufika pale unashuka kwenye mtumbwi mdogo unaenda nchi kavu. Kwanza nilipofika pale Ikola, na maana nilifika jioni, ilibidi nilale pale. Kesho yake asubuhi saa 12 niliondoka na hiasi mpaka Mpanda ambayo tulitumia masaa 5. Baada ya kufika Mpanda ndo nikakata tiketi tena ya basi kutoka pale Mpanda mpaka kuja Kigoma.
No matter the distance they traveled, they all had one reason to attend.
Haya mafunzo yanatufanya sisi tupate uwezo mzuri wa kuweza kuhudumia wagonjwa wetu, hasa kina mama. Kwa mafunzo haya na uhakika kwamba vifo vya kina mama na watoto vitapungua, kwa sababu tunajifunza namna nzuri ya kuweza kufanya upasuaji kwa wamama ambao wanapata complication na namna kuchukua maamuzi kwa usahihi na wakati sahihi ili kusaidia kina mama. Mimi na daktari mwenzangu ambao tumekuja hapa na madaktari wengine wa sehemu nyingine, naamini kila watu watatoka na kitu kizuri ambacho kinaweza kuwasaidia katika kuokoa maisha ya kina mama. Kwa ujumla ni mazuri sana.
Kwa mafunzo haya nimefurahi, kwanza nimejifunza kituo chetu kile kinatakiwa kwanza kiboreshwe, madaktari wawepo zaidi ya 2 kwa sababu sasa ni daktari mmoja. Kwa natakiwa madaktari wawepo zaidi ya 2 ili mama mjamzito anapofika pale apate huduma za kama ana uzazi pingamizi aweze kuhudumiwa pale pale ili kuokoa maisha yake yeye na mtoto wake. Ukisema uende kwenye kituo jirani, kama hakuna boti ambayo linapita kuja kituo kimoja kinaitwa Buhingo, analazimika mama na ndugu zake wakodi mtumbu mdogo ambao wanaweza kutumia masaa 6 mpaka 7 hadi kufika pale kwenye kituo ambacho kinatoa upasuaji. Na kama pale akimkuta daktari hayupo, kutoka pale tena kwenda kituo kingine kinachofuata upasuaji ni Ilagala, ambako tena kuna masaa zaidi ya masaa 5 mpaka 6. Ndio akifika pale, akikuta pale daktari yupo atahudumiwa, asipomkuta hayupo, ina maana atalazimika aje hospitali ya mkoa Maweni, ambako ni muda wa masaa kuanzia 12 mpaka masaa 13 ndio anafika katika kituo cha huduma.
This is very good because you want your suture to be here away from this edge.
While the teaching tools are simple, the lessons learned will stay with these medical professionals for a lifetime.
We have different sessions. We start from knot tying with sutures and moving on to inanimate objects, moving on to beef heart, for example, on the 3rd day. beef heart is a smooth muscle structure that's the size and the shape of a postpartum uterus. So it's a very nice model to have them cut onto the beef heart and then suture it up, and we can look at the suturing, make sure they do a good job with it so that it doesn't fall apart, the knots are good, that sort of thing.
I just want to make sure it's not pinned down before we try to do that. They're pretty amazing people when you think about what they do. They have to be so strong and so confident in their skills and so resilient because they're dealing with very sick people and they literally have no backup. They are it. They have to be excellent at what they do and they have to be very confident in their skills.
Dr. Moshi Kigwenya works at the Kasulu Town Hospital. Between 4,000 and 4,500 women come to this hospital annually to give birth.
Doctors are now performing operations with confidence.
Because of the CNIS training, the doctors at Kasulu Council Hospital are now performing roughly 50 more cesarean sections per month than they did before the training.
Most of us who are performing cesarean section are now performing cesarean section to the high quality form compared to before the training.
You want them to work together as a team, hopefully, if it's available to them, so that they can bounce off each other and help each other.
These guys are sharp, they're very, very committed. They're every bit as smart as any medical student I've ever had in Canada. What they have lacked is the resources for them to truly develop the excellent skills that they need.
You got it? The bed is fresh. Perfect. Oh, that's amazing. Good job.
Relationships and trust are beginning to build between the CNIS instructors and their Tanzanian counterparts by the end of the 3-day session. It is the recurring visits and additional instructions that allow these professionals to do their job to the best of their abilities.
The idea of working with a program where you're not here once and then gone, but you're coming back again and again, looking at how the skills are being used, looking at how they're being refreshed, looking at how your local faculty is working with their own students to make sure that the skills are sustained. That is truly increasing capacity in places like Tanzania that desperately need to increase their surgical capacity.